Good evening and welcome to the Alpha Phi Alpha Fraternity Incorporated Surgeon General Initiative webinar. In fact, this is the last one of the year. We welcome you and thank you for participating, and we certainly wish you happy holidays. It is indeed a pleasure to be here. Typically, I begin these by saying on behalf of the General President of Alpha Phi Alpha, Brother Dr. Willis Lonzer III, but we are graced with his presence today, and I will begin this roundtable discussion with Brother President and the Deputy Surgeon Generals by introducing our General President, Dr. Willis Lonzer III. He's an international leader in fraternity, business, and his community. In fact, he's an executive scientist with over 20 years of global pharmaceutical research and development and global medical affairs experience. I must say I've absolutely delighted in our conversations about public health, medicine, and science to that end. He's a native of Richmond, Virginia, where he matriculated to Delaware State University, where he joined our illustrious fraternity through the Gamma Sigma chapter on November 15th, 1986. He also holds the Doctor of Philosophy degree in biochemistry from the University of Akron, where he was a prestigious Patricia Roberts Harris pre-doctoral fellow. Dr. Lonzo was also a postdoctoral fellow in physiology and biophysics at Case Western Reserve University's School of Medicine. Welcome, Brother President, General President, Dr. Lonzo.
Thank you, Brother Dr. Sterling, our esteemed Surgeon General, the first one in the fraternity's history. Happy to see you functioning so well in your role. I'm not surprised at the success of the initiative and the aggregation of this great cluster of scientists and physicians who come together to support our brotherhood and to move us forward as we march onward and upward toward the light. So I'm here at the discretion of the brothers tonight to talk about things that are going to impact us as a fraternity, as a community of leaders. And I'm excited to be here. I'm in a hotel, if you can't tell, but nonetheless, it's great to be here with you this evening.
Well, thank you. Before we bring in the panel for this evening, I think it should be commented on that this is the first time that you and I have had an opportunity to really discuss the Surgeon General Initiative publicly. And there may be some historical opportunity for us just to discuss the vision. As I mentioned before, I am just enamored with the meeting of the minds and appreciative of the opportunity to participate and serve the fraternity in this way. So I'd like to just introduce three quick topics for us to discuss and to put out for a better understanding for members of the fraternity and others around the country and in fact internationally who care about matters of public health, science, and medicine, and who will benefit from understanding the leadership role that Alpha Phi Alpha is taking along those lines. So to that end, Brother General President, the vision, let's just talk about that in terms of how you visualize Alpha Phi Alpha's role in providing health information to its members, our families, and the communities we serve, both through this Surgeon General initiative and through other efforts that the fraternity is long engaged in.
Well, thank you for the opportunity to share this vision. I foresee Alpha Phi Alpha, and we've already begun to enact this, to be leaders and to be a conduit of information to two branches of people. One is to the brothers that we are bonded to fraternally, to provide information that is cutting edge, often information that may be somewhat hidden or obscure from the general population and need a scientific or medical practitioner to come through and discuss it, to tee it up or produce it in a way so that it can be a practical discussion that can be applied to a person's life. But more importantly, we, like our motto says, that we're first of all servants of all, we shall transcend all. We cannot transcend from the grave. We have to make sure that our health and our health objectives are priming us for longevity as long as we can serve and engage the community. But as a result of us taking an interest in our own personal health, we also can now champion it within our own communities abroad so that people can, young and old, can be a part of this dynamic discussion from a practical public health challenge like COVID-19 to even the more, I would say, filled in and fabric oriented discussion on diet and lifestyle, things that are very much integrated into the balance of our lives and in our walk in the community, and not necessarily championed by anyone, but we can even lead in that area through some of the very direct discussions that deal with our mental health, with our dental health, with our mental health, as well as our overall physiologic health. When we talk about managing obesity, looking at those components that are very much relevant to our daily lives, from cardiovascular to diabetes to even urologic health in its own right. When we talk about prostate cancer and other components that are there, I mean, the arsenal that we can bring to the table is unlimited, and we eventually will even begin to impact our own practitioners by bringing scientific discussions and leading discussions to them that are cutting edge and helping them in their own practice. So I'll leave it there, and hopefully that's a good primer for you to move us along.
Well, certainly, I actually would comment as well that in the event that anyone thinks that sounds ambitious or audacious, it is a case in point that as these things go, the fraternity has such a large cluster of African American and Black men internationally, as well as here in the United States, and individuals who serve in leadership roles in public health, in science, in medicine. It should be considered a natural for Alpha Phi Alpha to take a leadership role internally in providing pathways forward. So I think it's necessary, as well as something that we very much are capable of. And I'm very glad to be a part of that opportunity. As I mentioned before, Brother General President, Alpha has long had a role in providing national leadership and engaging in strategic alliances, and that will also be strengthened. It's very nice how the entirety of the health programming and activities of the fraternity are coming together. I know you would want to mention some of the other strategic alliances and organizations with whom Alpha Phi Alpha has partnerships, because it's important to know as we engage in the ongoing conversation that we're going to be doing a lot more than providing webinars. Our activities are going to be seen near, far, and wide. So perhaps you'd like to comment on some of our other efforts.
Sure, I'm very happy to do that. And what's amazing is that we have taken what typically is used by organizations like ours, a health and wellness, and turned our health and wellness committee or working group into an outreach mechanism, one that partners with and seeks to partner with community-based organizations from the national cancers spectrum, where you're talking about the American Cancer Society, the Ola, the Orly Smith Cancer Driven Society, and Dr. Hadia Green is going to have to forgive me tonight for having a quick name slip there, but her initiatives and actual modality to treat cancer is one that's very far-reaching and the most aggressive that we've seen around, in addition to cancer education, that we've seen in recent years. And the fact that she's an African-American woman and a scientist as well, medical physicist, I'm very proud of the work she's doing. We are also partnering with the National Disability Institute, even though that will be run through a different arm of our fraternity, as we are now announcing a disability a disability-driven committee or working group, which will serve us internationally. We use the term general disability intervention group. That general component means that it covers our entire organization, and we're partnering with the National Disability Institute in the United States, but seeking international partners as well. We are also seeking and will be seeking a relationship with the United Nations as well, and to align our health component even with the World Health Organization, so that we, for the brothers who live outside of the United States, in Bermuda, in the Bahamas, who perhaps they live in the United Kingdom, or perhaps in one of our newer provincial chartered components like in Accra, Ghana, or Dubai, or even in some other areas, we want to make sure we're supportive of our health initiatives internally, but also how we can partner externally and ensure that Alpha Phi Alpha is aligning with the communities in which we support, and literally fulfilling our mission to be advocates for our community, not only in the ways of public discourse, law, but also health. Excuse me.
Agreed. To coin a phrase, first of all, there's health. And I think in the ongoing efforts to uplift, um, addressing the fundamental issue of health amongst ourselves and amongst our communities really is a baseline effort that will lay the groundwork for so many other things that define us and that we aspire to accomplish. So thank you for your leadership in moving this forward. And there's so many ways in which this touches. And I would actually like to add as well the fact that the Surgeon General initiative means to be a vehicle for many of those types of activities. Everyone is already familiar with the weekly webinars that have touched on any and every topic of relevance. And I will take an aside right now and invite members of the viewing audience to submit any questions. We are going to have a session this evening where we take your comments. Some comments have already been submitted in advance, and we'll address those as well. But we want this to be an interactive session because we want to be responsive. We just aren't talking at you. So these webinars are great, but you also very shortly are going to begin to see over on our YouTube platform, Sphinx TV, where we will be posting almost 100 different vignettes where we talk about health topics to give you quick answers and things that you can use to empower yourself. And over this upcoming year, look for Alpha Phi Alpha to really be in the community, engaging policymakers and supporting and advocating for policies that eradicate healthcare disparities and equities and really level the playing field and empower us to do what it is we do. So that's where we're going with this. Brother General President, did you have any additional comments that you'd like to add before I invite on the Deputy Surgeon Generals?
I would just say that we have innovated a move that I've not seen any other fraternity or sorority or any other social or civically charged organization do in what we've done with the Surgeon General Initiative. And mind you, brother Dr. Sterling and other brothers who are also the deputy surgeon generals and other brothers who are also contributing members of this Surgeon General's initiative are trailblazers along with me and along with the fraternity in setting a new precedent that we have to drive the healthcare narrative internally as well as for our communities. We often will do it through professional means and through other advocacy organizations. You think about the National Medical Association, and I know Brother Dr. Bailey is a past national president of the NMA, the AMA, other advocacy organizations, but no fraternity and sorority has ever done this. And we're doing it, or at least to the degree which we are doing it. And I want to make sure that we set a precedent, that we establish that Alpha Phi Alpha definitely is a leader, but we're not selfish. We want to make sure we share our best practices, but we elevate our community like a tide elevates all boats. It's important that we live longer. We have a lot of fighting to do to make sure that individuals in our nation and around the world are living the best lives we can live. So I'll leave it there, brother Dr. Sterling, and let us move on to the next component.
Fantastic, and thank you again so much. You touched on where I plan on segging. We mentioned that we actually have 6 deputies who participate in the Surgeon General Initiative, but I would certainly be remiss if I did not point out that there are about 100 brothers, members of Alpha Phi Alpha Fraternity, who also provide incredible efforts and leadership. You've seen them participating in the webinars. This is truly a momentous effort, and we wanted to become a revolution. I'm going to hold back on that just yet. We want to match outcomes with the aspirations, but there are a lot of people to whom we are grateful for bringing this to fruition and who continue to push it forward. You can imagine that it's no small effort to put out the volume of events that we're putting out, but stay tuned. There's so much more that needs to be done, not for the sake of doing it, but simply because we need to match the need that exists. So without further ado, allow me to bring on board 5 of our 6 Deputy Surgeon Generals, and I will say a brief part about them, but I really want to allow them to describe not only themselves and their work, but how they're bringing that leadership that Brother General President discussed to the table to elevate the Surgeon General initiative. So we have Dr. Langston Smith, who is the Deputy Surgeon General for Dental Health. He pledged as a member of Delta Phi back in 1964 and is currently a member of Iota Upsilon Lambda. Good evening, Brother Dr. Smith. We'll be back to you momentarily. We also have Brother Dr. Victor Narcisse III, who is our Deputy Surgeon General for Family Health. He pledged at the Rho Iota chapter of Alpha Phi Alpha in 1990 and currently is a member of Alpha Eta Lambda chapter. Our Deputy Surgeon General for Health Disparities is Brother Dr. Christopher Womack, who pledged at Omicron Delta Lambda in 1988, currently a member of Sigma Mu Lambda. Our Deputy Surgeon General for International Health and Tropical Medicine is Brother Dr. Robert Carter III, who pledged at Theta Chi chapter in 1992 and is a member of the general organization. As mentioned, Brother Dr. Ron Kennedy Bailey is our Deputy Surgeon General of Mental Health. He pledged at Alpha Rho in 1984 and is currently a member of Alpha Eta Lambda. And our Deputy Surgeon General for Public Health is not with us today, but that is Dr. Torrance Brown at Gamma Upsilon 1997 and is currently a member of Pi Upsilon Lambda. I'm not going to let all you guys get away with recognizing your chapters without me acknowledging Alpha Mu Northwestern University, 1682, and certainly Beta Tau Lambda in Fort Worth, Texas. So welcome, everyone.
All right.
Thank you.
You know, this question actually is for everyone, and we're just going to go around the horn. I really just want you to tell us why you view this as meaningful. Tell us a little bit about yourself, your path, how that's brought you here. Tell us a little bit about what your subcommittee is addressing and how your subcommittee is seeking to implement and elevate the Surgeon General initiative. That's a lot, but again, I want each of you to take a few minutes and just really tell us your story and get into what you see, how you've bought into the vision, how you're elevating the vision, and again, accept my thanks for everything that you've done. Let's start with Brother Dr. Smith.
Thank you, Brother Sterling. Good evening, General President Lonzer, Brothers of Alpha, and guest. I am Dr. Langston Smith, as Brother Sterling mentioned, initiated 1964 in Delta Phi at Jackson State College, now University, and the 2021 champions of the SWAC. And on to the Cricket Celebration Bowl, where we meet South Carolina State. Anyway, it is good to be with you this evening. I did my dental training at the University of Kentucky, and I'm a board-certified endodontist, getting my endo training at the Naval Postgraduate Dental School there in Bethesda, Maryland. I am a 30-year Navy retiree, having practiced dentistry in the Navy for 30 years. Following that, I took a responsibility as a department chair at the College of Dentistry of Howard University in Washington, D.C. So I'm currently retired, and trying to enjoy what I worked hard for all of these years. I appreciate and want to thank General President Lonzer for this vision of the Surgeon General Initiative, the very first of its kind. And I want to thank Brother Sterling for leading and guiding us along these lines. Because you see, what has actually happened is we should have a focus on health, especially as it pertains to the African American, where there is a disparity in access to health care, and education in health. So this is so meaningful from that perspective. And for us to provide a conduit of information out to the brothers, out to the chapters, out to the local communities, make this all worthwhile. The dental health team, which there are 9-10 other brothers on this team with me, we realize that we want to reach out to the brothers, their families, and the communities about dental health. All too often, we have put dental health on the back burner. We have not really been too concerned. The idea says, oh, we'll get to that later. And later, it becomes more problematic. So one of our first objectives is to inform brothers that oral health, dental health, is just as important as your total overall health. Because you see, we did a webinar not long ago. And in that webinar, we talked about how dental health and systemic health are related. And so we want to be able to provide this information out to the brothers. A second goal of the dental health team is to get brothers to take an active role in their own dental care. In elevating the spirit of Alpha, we want you to have the knowledge so that you can share in the decision-making process of your own oral health. And this will then translate to your families. So it's not just having a role in the decision-making process of your own oral health, but in your total health. We find all too often we don't know what questions to ask, how to engage the practitioner or provider about our health. And so this is very important when it comes to dental health. Okay. We will also offer you the ABCs of general health so that you can know how your dental health relates to your oral health. We will discuss such topics as oral health and diabetes, oral health and kidney disease, nutrition and dental health, oral cancer, how to care for your dentures. We will talk about a lot about what you're hearing in the media these days, such as orthodontics and tooth whitening. All right. So these are some of the things that we hope to bring forth to you in the vignettes that Dr. Sterling mentioned that will be coming to you, that we're working hard on producing at this point in time. So we want to also share information on the disparity of dental health in the African American community. As you may have read, or as you may know, there is a growing divide in access to oral health for both adults and children. And so this is not just an access to health care itself, but also an understanding what oral care is and how to prevent the development of dental disease. So we will spend quite a bit of time and send out a lot of information on prevention. Prevention is the key to oral health. If we can prevent it and keep it from happening, then we don't have to deal with the problems later on. So the dental health team role is going to be sharing information, pushing out information to you, the brothers, to the chapters, and so that you can relay that to the communities. That these are our concerns. This is what we as the subject matter experts in dentistry know. And we want to share that with you so that you can become better informed, more knowledgeable on how to care for your own teeth and your oral condition and how to care for those of your family. So we are looking forward to working with you on this and getting this information out. Thank you so very much.
Brother Sterling, I think you're muted, my brother.
Thank you, Brother General President. Next up, let's go over to Brother Dr. Victor Narcisse, our Deputy Surgeon General for Family Health.
Good evening. The Family Health Committee is comprised of individuals from all backgrounds in medicine, from primary care providers to orthopedic surgeons, transplant surgeons, gastroenterologists specializing in cancers. And from all these walks of life, we bring a tremendous experience and knowledge in a whole host of topics that we think are very, very important to you and your families. The thing that I am very accustomed to as an academic physician, I am certified in internal medicine, geriatric medicine, and I practice as a hospital medicine physician. But my training is in primary care. And in primary care, I trained at the Baylor College of Medicine in Houston, Texas. We talk about the things that we often experience in our communities, such as diabetes, cholesterol, heart disease. And we're accustomed to giving lectures to students of all levels of training. And we are accustomed to sitting in a room and talking to individuals as we provide them care. But this experience through the Surgeon General Initiative has allowed us to take this knowledge that we are so accustomed to sharing in a lecture hall and actually amplify that message. And that message is going out to our community. And that's where we really think it needs to go. From the towers of academia and the medical communities out to our communities, to people that we encounter every day. When I was asked to serve in this capacity, I thought that, okay, I can do that. I can provide some education based on my experience. But what I didn't appreciate and what I didn't know was going to happen is that each one of these topics has touched my life and the lives of the people around me so deeply. We educate on diabetes. This past week, one of my best friends, I had admitted to the hospital with new onset diabetes. Cholesterol management is something that is near and dear to myself and basically everyone from New Orleans, Louisiana, where I'm from. If you didn't know already, New Orleans has the best food. No offense to my Houston community. New Orleans has the best food. The problem is that the food that I love to eat from New Orleans is not necessarily always the right choice for my health. And so I'm personally grappling with that. We've been discussing healthy aging. I'm a geriatrician, and my background has been in memory problems and Alzheimer's disease and how to keep people out of the hospital. So as we talk about this, I've been communicating with my friends in my community about their parents in the hospital, going through the progression of life, needing advanced care, maybe even hospice care. And so this has been a unique opportunity. The diet and nutrition, I mentioned them from New Orleans. And what I had mentioned is that I'm probably a better educator about diet and exercise than I am a participant and follower of those things historically. But with COVID, I work in a high-risk environment. I decided to make a change in my lifestyle, and I started exercising. And as I've started to exercise, I've started to engage with other people who are trying to exercise or have been doing more. And I think that that mentorship has gone far and wide. We've been educating people about cancer and how to prevent and early detect things such as breast cancer. We've participated in the prostate cancer discussions that some of the other Surgeon Generals, Deputy Surgeon Generals have spearheaded, and this has been a great thing. And we've been able to partner with other organizations. And now, based on the strength of our presentations, others are coming to us from our communities and asking us, could you now have a similar conversation with our members? So we talk about the diseases that impact not just the entire community, but an individual where you live, in the room where you sleep, at the table where you eat. And that's the thing that I found most humbling. There's so many people involved with this, and I'm just one of those, trying to humbly bring some additional experience to the group. But it's been a remarkable experience, and we're hoping for this upcoming year to only provide more of the education through webinars and through recorded discussions.
Brother Sterling, you're on mute again, my brother.
I think I'm going to ask Brother Hollis to make sure that I don't go on mute anymore, but I apologize for that. Yeah, I was just saying that, Brother Narcisse, I agree with you completely. It's just been wondrous the extent to which these webinars have caused many, myself included, and those close to us. I try to do it all day, every day anyway, but it's been wonderfully reflective to see just how much of the talk we're walking, and these best practices that have been promoted have certainly provided accurate information and just a smidgen of advice that has really been helpful, and we want to continue to build upon that. Brother Dr. Christopher Womack is our Deputy Surgeon General for Health Disparities. Good evening, welcome, and tell us a little bit about yourself and your thoughts, whatever you want. The floor is yours.
Greetings. Thank you, Brother Sterling, and greetings, Brother President, and to all the brothers and everyone listening this evening. First of all, thank you all for connecting in these sessions. We believe this discussion is very important, and for us to take not only a leadership role, but also a very active role in addressing areas of health disparities. My team is composed of researchers, clinicians, and just feet on the street activists regarding health. When our team met, one of the first reasons I gave why I'm doing this, and believe all of us who are on this session today have very busy lives, professional and family lives. But one thing I want to make sure that we did as part of this to get across to everyone is to understand that you matter. Everything we do, we want to make sure you matter, because the healthcare disparities that exist should not be tolerated, and we want to make sure we should not be accepting of them. The leading cause of death for African Americans are heart disease, cancer, and accidents. African Americans have the highest mortality rate for all cancers combined compared with any other racial and ethnic group. That is not acceptable. Some of the goals that we work on with our team, and just to give you an idea what sets this sort of the general topic, the focus on this, there is a song called Slipping into Darkness by War. And I equate with slipping into darkness is without having access to that information and understanding what's going on as it relates to health. So one of the things we try to do is create awareness with everything that we do, with every program that we do. The second thing we ask is that not only do we create awareness, is that people who participate in our sessions take that information and spread it to others. There is never any such thing as an inopportune time to talk about prostate cancer screening. The third part we also want to do is act on that information, not just take it in, not just spread it, but act on the information. Go get your screening, go to your healthcare provider, have dialogue, two-way dialogue with your healthcare provider and with your family members. One of the other things we're also working on and just started recently having these discussions is on policy. Policy impacts how our healthcare takes care of us and how we utilize healthcare as well. Thus far, we've had 3 webinars, one on prostate, which was prostate cancer screening. And it went over so well that there was a call from others to say, we would like for you to have another prostate cancer discussion. So we had part 2, which was prostate cancer diagnosis, which went over well, and we've received notifications from brothers who said, no, I haven't even gone for a screening, or I haven't had dialogue with my doctor. And it's the first time they have real dialogue looking at their PSA scores and things of that nature. We also had a discussion around HIV and AIDS. Somehow that seemed to go to the back end of discussion, especially looking at COVID, but overall health as well. We want to make sure, no, HIV and AIDS is still a danger in our community and needs to be addressed. Our team is very dedicated to the cause of our group itself in terms of making sure we get this information out to you and that we act on it. We also want to play a pivotal role in influencing policy and getting our general organization to take on policy causes, to go to legislators to say, this needs to be passed. This needs to be addressed in our communities. So these are some of the active roles that we're playing a role in. And I also want to make sure, I would be remiss if I don't mention this, is not only the people in healthcare disparities team, but we have people who come into our team just wanted to pitch in on certain areas to help out. And that's always accepting, because we find that there's a need. They're heeding the call to come involved, to get involved with this. And we really appreciate it. And we will continue this fight to make sure this information gets out to you, your family, and your loved ones. So thank you very much, Brother Dr. Sterling.
Thank you. And I just want to reaffirm something that you said that's very important. One thing that the health disparities and the public health committees have in common is that they're, as opposed to some of the more clinical committees, are not going to be focusing on webinars per se, as much on the development of policies, programming, and advocacy nationally. So as these think tanks grow and ruminate, look for those types of things, because we know where the challenges are within our communities, and we very much plan on taking action to address some of these concerns. Let's see, next up, we're going to offer the floor to Dr. Ron Bailey, our Deputy Surgeon General of Mental Health. Good evening, Brother Bailey.
Well, good evening, and thank you very much, both to General President Lonzer and also to our esteemed Surgeon General, our Brother Jeff Sterling. I know for a long time. I thank you for having us on tonight. Ron Bailey, happy you mentioned earlier, I'm from Alpha Row, played at Wells College in '84. Went to med school in Texas, so a little different than Brother Victor Narcisse. He's from New Orleans and now is in Houston. I'm from Houston and recently moved to New Orleans, so we're exchanging our roles here. But very happy to, I think, be in this role of Deputy Surgeon General for our fraternity for mental health and psychiatry. There's a lot to do and a lot to be stated. I think that first and foremost, I'll make the point that if we can spend time on educational programs like this, working to destigmatize mental illness and focus on and encourage mental health concerns and proactive activity in this regard for African American men, we will have done a good job and use our time very, very wisely. The reality is all too often, because of stigma and fear and misinformation and embarrassment, individuals who are African American will allow more adverse concerns to occur to them than the positive issues that can occur when we get good overall quality health care. So again, we thank our General President for giving this issue, I think, the moment that it needs, and really putting it on, I think, a stage that's important enough for all to take it seriously, I think, as it indicated. I'd certainly begin by, I think, thanking the other 10 members, I think, of our group. Our task force on mental health has been very diligent in having monthly meetings and really sharing ideas. We have social workers and psychologists. We have psychiatrists, other mental health professionals, case managers, persons who have spent their careers really toiling in these areas of mental health concerns. And we all very often share much of the collective disappointment in the lack of adequate resources brought to bear very often by the government, because very often state departments of healthcare pay for state hospitals. Also, all too often, I think there's a lack of access concern in our business. We've actually talked about and really tried to work on developing some strategies that we may be able to work through Alpha to really push, I think, an initiative going forward. All too often, if you have a non-brain related healthcare problem, so-called a medical problem in society, there's a clinic to go to. It's easy to access, and you can actually get there, and you can use your gold card for care if so be it. All too often, the disparities occur in mental health concerns and psychiatric illnesses because of the barriers to receive mental health care, psychiatric care, often a different location for where you're going to access that care, and often very different parameters. Throughout my whole career, we've spoken and fought on an advocacy issue that all too often, if you have private health insurance, for example, the lifetime caps are lower for brain-related illnesses like depression and bipolar disorder, schizoaffective disorder, alcoholism, or what have you, if you will, and the co-pays are higher. All issues that I think very often disproportionately adverse affect individuals in this setting, and you put that on top of the issue regarding stigma, that I think worsens the concern I think that's in play. Many of the topics that we've addressed, I think, are key issues. I mentioned major depression and anxiety disorders. 70% of the time, persons who have these problems are likely to have both. They have comorbid illness, or they have more than one problem, which is why it's so difficult in psychiatry to get a cure or get to full remission, because often you're battling more than one illness or disease concurrently. In addition, I think all too often, what's easy in American society now and in the past has been to self-medicate. So a person has some difficulty before going to a medical professional. At best, they may go to a primary care doctor. That's certainly a good move for them. But if not, they often will try to self-medicate, very often with alcohol or marijuana or other substances, toxic substances, some legal, some illegal. It causes just a wealth of problems. The fallout of kickback using items that are not geared to be beneficial in this regard or problematic. If some are illegal, I mentioned marijuana, some others, and that leads to the entire legal industrial complex that comes into play, which historically has led to the over incarceration of young Black males and really, in many regards, hurt entire societies when persons are very often trying to deal with healthcare problems with legal or educational or fiscal solutions. We need healthcare strategy solutions for these very often major healthcare type problems. I'd also say that, I'm a forensic psychiatrist by training. So I hope to bring that element of our work to bear, because all too often the forensic or medical legal issues, again, create a very disproportionate adversity and a healthcare disparity, in my opinion, in our community. Very often adverse to young Black males. We all can cut on YouTube now, and every other day, basically, there's some video of some exchange between a person in their vehicle and a police officer and law enforcement, and often the issues may not be seem to be fair for the African-American male. And very often that starts a process. The person gets a lawyer and goes to court, and then there's an evaluation and there's some legal determination. That entire construct, all too often, has created grave difficulty that very often, in my opinion, doesn't really have to exist in these type settings. If we can actually have early intervention, proactive education to make communities in our community aware of what their opportunities are and their rights are legally, but also their healthcare strategies that can be engaged when necessary and when optimistic. And also, I think concerns that may actually limit substantial long-term difficulty in those regards over time. My final point, I think it's hard for psychiatrists to ever have an opportunity to speak on education and not talk about, the big ticket item, the red letter issue of self-harm or violence in general, whether it's self-harm, suicide, or whether it's externalized violence, homicide, or aggravated violence in our communities. There's just way too much of that, I think, in our community. We must, I think, discuss these issues and begin to develop strategies that I think are likely to be effective going forward. But they should be proactive. They probably should begin at a grassroots level. Issues regarding in churches and community settings, or what is it with families, interconnecting in ways that help identify persons early on who may be at some higher degree of risk. Young men who may actually be kind of lost in the shuffle, who don't have the benefit of the positive pat on the back of great academics or athletics or some talent that society values. And all too often, those persons are kind of lost in the shuffle and may end up leading to scenarios that are negativistic, I think, in our society. As we see that occur more and more, I think all too often we've struggled in our community trying to figure out how best to intervene, because we all want to be safe. We also don't want to lose so many of our young men in the criminal justice system. So we got a lot of work to do, I think, in organized medicine, especially those of us who are African American in the mental health field, to find ways to help our community grow and improve in all these areas. And I think that Alpha Alpha has done a great job beginning this process with the Surgeons Initiative, trying to bring some brains together, some ideas together. We might be able to collectively create, I think, a pack going forward that may be useful and beneficial for our whole community. So thanks for having me. I look forward to the question and answer.
Thank you. I think it bears to be said, Dr. Bailey, that this initiative really aims to, in the ways in which we can, obliterate the notion that mental health is something that's not available to Black and Latino men, or that it's a luxury that we can't afford because of all that's occurring in our lives. We want to offer you the information that's necessary for you to not treat yourself necessarily, but to be empowered, to have better coping skills, etc. There's a seg here that you pointed out that's wonderful. As I mentioned, Brother Dr. Torrance Brown, our Deputy Surgeon General for Public Health, is not with us, but I would just point out that public health actually is the intersection. There's an intersection between public health and each of our other subcommittees. We will be looking at the social determinants and influences of health. We will be looking at health disparities and inequities, and so many ways in which we can bring conversations to you to be better stewards of your health. So keep that in mind. Public health and health disparities are two committees that really aim to work with you, to give you tools to do better for yourselves and your families, even as we break down barriers to care that may exist for you. Now we're going to move on to the question and answers. We've gotten some pretty good ones here. I'm just going to open this up and I'll invite the entire panel to the webinar. So let's bring everyone back up, please. I just want to start by asking everyone, and feel free to chip in, you don't have to, but if you have a piece of advice that your subcommittee, that's resonated within your subcommittee, or you individually would just like to offer to the viewing public, go for it. Let's hear what you would have to say, and limit it please to just one quick comment, because we have a few questions that we want to get through. So let's go around the horn, and let's start again with Brother Langston, Dr. Langston Smith. Well, let me open it up to anyone that wants to comment. What piece of advice would you give to the viewing public on managing their health?
Sure. If I could, from the Family Health Committee, the piece of advice I would give is that everyone needs to have a medical professional that you have a connection with, that you can ask questions of, that can evaluate you and tailor a unique health plan with you. And I think that a primary care provider is something that many in our communities don't have, but there are ways for almost everyone in the United States to access primary care. I would advocate strongly for that.
Absolutely, thank you. And I'll caveat that, put a caveat on that and say qualified medical professional, of course. Other thoughts, comments?
Before we go further, Brother Sterling, did you miss Brother Carter?
If I did, I apologize. Let's see here.
Brother Carter's on.
Yes, I see you there. Oh my goodness. I know the Brother General President, and I joke about this all the time because we never want to forget our international brothers. That is an ongoing topic of conversation. So the irony of such things is not lost on either one of us, I'm sure. My apologies, Brother Dr. Carter. Please go ahead and have your time at bat. Please go ahead. Thank you.
The opportunity to participate in this wonderful initiative. It's an initiative that's incredibly important, in particular at times when our communities often don't get information that they can trust. And I had an opportunity actually to talk with the international chapter. I participated in their meeting recently, and really shared specifically what this initiative is doing to address health issues, not only at the point of destination. Often, much of our talks have actually focused specifically on what is needed at the destination. But this particular group is really focused on not just what happens once brothers or members of our community arrive at their destination, whether that's local, within the state, or internationally, but what are some of the preparatory things they need to do to prepare themselves and their families to safely make that destination, and also things they can do to mitigate and address health issues prior, and so that they don't necessarily have to address some of those issues in an emergency setting at destination. So again, really excited to be part of this group. I'm trained actually as a physiologist and biophysicist, much like Brother General President, and follow that on with training at Harvard School of Public Health in epidemiology and global health. And one of the things that is clearly recognized is that by addressing specifically travel, often individuals will travel, and the stress of travel can lead to the exacerbation of pre-existing conditions. And this is an area that we often don't talk about, but during the period, in particular during a pandemic and during this holiday season, many of us will travel. And it's critical for us to understand not only the risk of transmitting the virus, but also the other inherent risks associated with travel. So I would like to say that really the International Travel Medicine Group, it's about 6 of us. We have a really interdisciplinary team that's looking at travel from a holistic perspective, so that we can share and provide information with brothers in the community that is actionable. So I would like our phrase, at least our vision is as a travel medicine international health group, is really to flatten the curve of health disparities. So by interacting and with the health disparities group, collaborating with the other deputy surgeon generals, really looking at issues that are cross-cutting, that impact our communities at their in their home life, but also impact them at their point of destination. So whether that's issues related to mental health exacerbation during the holiday season, or mental health issues that may be exacerbated due to the stress of travel. We also are focused on nutrition. Many of us will have our staple diet, in particular individuals that have a diet that's around managing diabetes or other chronic diseases, one of the questions is, how do you maintain that type of diet when you're traveling? So we're going to really address really a number of issues and really work with the other committees to ensure that we're providing information that is helping to flatten that curve of health disparities and diseases that are exacerbated and that manifest, in particular during the holiday season when many of us travel, but also just throughout the year. The population, our brother population and population in general is aging, and being aware of some of those issues that can manifest is just really critical. And so the last point I would really like to make is just share a quote with you of what participating in this committee really means to me personally. And this is one that my grandfather, we lost him during the pandemic due to COVID and pre-existing conditions early on. But one of the things he always shared with me is that nothing in life is to be feared, but only that you don't understand. So during this time, it's critical for us to share with our brotherhood and our community information so that they can live and trust in the overall healthcare system where they can fear less and take more advantage of what we have to offer. So education is obviously a keystone of Alpha Phi Alpha. So providing education, in particular in the health space, is helping to facilitate that change and help to flatten that curve, not just related to COVID and the pandemic, but just flattening that curve and health disparities in general. Thanks, brother. I'm excited to be part of this group, and I look forward to participating and doing whatever I possibly can to ensure that we are enriching the lives of our brotherhood and our communities.
Thank you. That was fantastic. I again invite the brothers. We have some good questions, so I'm going to ask brothers to provide us with some quick hit answers to the questions. And I think that where we were was just if you had a piece of advice from you or your subcommittee to offer to the general public. And I'm going to go around the horn so everyone's not talking over each other. Let's again, I think that we got Brother Dr. Smith's comment, Dr. Narcisse, and let's go to Dr. Womack.
Yes, sure, Dr. Sterling. One piece of advice that resonates to our committee is for people to understand that ignorance is not a cure. Let me repeat that. Ignorance is not a cure. And what that means is do not ignore symptoms that you have within your body that you need to be reporting to a healthcare provider. Do not ignore health histories of your family. If Uncle Joe had prostate cancer and Uncle Sam had prostate cancer, most likely you're a high risk candidate for that. Don't ignore that. Get tested. The same thing with Aunt Susie and Aunt Joanna. If they had breast cancer and you're part of that bloodline, you need to get tested as well and checked. So one important thing to keep in mind is that ignorance is not a cure. Be responsible for your health if possible.
Fantastic. Thank you, Brother Dr. Carter.
The most important thing that our committee would like to share with the brotherhood and the listeners is that prior to travel, whether it's in the car to visit Granny or taking an international flight to visit your favorite destination, be sure to do a proper health risk mitigation. Unfortunately, many people find themselves away from home, whether that's in the nation, near their loved ones, or at a destination away from the country or far away from home, and they find themselves lost without having the proper information on how to take care of themselves. And many individuals die unexpectedly due to health conditions that they could have otherwise survived if they had the information. So develop yourself a pre-travel checklist and ensure you know how to take advantage of emergency services, pharmacy services, and the services that you might need in the case of an emergency, to include travel insurance if you're traveling outside of your community where you typically receive services. In particular, if you're traveling internationally, travel insurance. Make sure you know how, if you become ill at the destination, how you're going to be able to safely mitigate any unexpected illnesses that come up.
Well, that sounds like a topic for an upcoming webinar. Thank you. Brother Dr. Bailey.
Yes, I think I hit on a point that I made earlier, and I know the psychiatrists, we hit this point a lot, but it really is, I think, to address the issue of stigma. I've learned in my career to say that, African men are people too. We have feelings, we have difficulties, we have hurts and emotions like all others. But I think much of the process of our society, and maybe over masculinity, some would argue, and some male-dominated concerns, leads to persons not going for health care or pursuing it when it may be available. I mentioned issue of access earlier, or trying to do it in some other way. I mentioned self-medicating with alcohol earlier, or other kind of concerns. So I think that we have to kind of let the air out of the balloon a little bit as families and groups. Very often, if a man does go for health care in our community, 80% of the time, an African woman, it could have been their mother or their sister, let alone their spouse or wife or what have you, really push them to go. So prevention means a lot. Pursuing care means a lot, and recognizing that persons have brain illnesses just as much as they have medical or body illnesses. In our dynamic of African men, I think is key, and it's a point that we cannot emphasize enough. All too often, so many of the sociological problems we find in society, I think very often, are at their core health-related concerns that, again, persons are trying to address with a health-related type of strategy. Those we need to pursue.
Thank you. Brother Dr. Lonzer and I are going to be offering closing comments, so unless he wants to jump in now, I know that he's going to touch on many things and as part of his closing comments. So I'm going to just jump over to the next question. Some pretty good questions here. Will Alpha get a nutritionist together and publish a recommended Alpha diet that caters and speaks to the physiology of African American and Latino brothers? I'm going to place that comment in a broader context. Part of what you'll be seeing from the Surgeon General initiative in the months and years to follow actually is going to be a series of recommendations, much in the way that Brother Dr. Carter mentioned, having to-do list for travel and other considerations. We actually envision providing you with 3x5 cards or things that are easily accessible online that actually offer tips and best practices for you to have at your fingertips so that you can engage in these things. The conversation about a specific diet, we certainly would refer you to established entities such as the American Dietary Association, American Heart Association's recommendations, et cetera. But rest assured, we're going to curate that information, distill it, and provide it to the brothers in ways that whether you have a series of pocket cards that you carry on your keychain, or there's an app or somewhere online that you can access through your smartphone, we do envision getting you tons of information much like this in the upcoming period of time. Are there any brothers that wanted to embellish on those comments?
Now, briefly, I'd just like to say that nutrition and exercise is a personal journey for all of us. We all begin someplace, we all have goals, and very few of us are at the place where we've achieved all those goals. So by having a conversation around things that we can do better, and by modeling these behaviors in our own communities, I think that we can provide a new set of examples that will lead to long-term gains and benefits.
And similarly, I mentioned earlier that Sphinx TV, you all should know that. It's on YouTube, the Sphinx TV channel. You will actually see as part of our offerings to you that we will be having 15-minute conversations that encompass things such as your health journey. And that's where you will easily be able to find a health library that offers this type of information. So stay tuned. We'll make an announcement when that's being rolled out, but this is exactly the type of content that we'll be releasing in the months to come. The next question is similar to part of the initiative that will be expanding. Several of us brothers completed the 50th TCS New York City Marathon and met for the first time. How can we embrace the brothers who run and support the Healthy Communities movement in our local chapters? Well, as mentioned earlier, we do believe that the Surgeon General Initiative will provide forums that lead to programming that will be picked up by regions and districts and others. As we engage in a health journey for the fraternity, we want that to travel down through the organization down to the members. So we actually look forward to having conversations about how the things that we talk about in these webinars become reality and you can practically apply them on the chapter level. So absolutely, yes, and thank you for that question. I think we have one more. Alpha is addressing mental health, but are we interested in providing help to brothers needing marital counseling and how they can deal with issues that have risen due to COVID-19? What I will say before tossing it to the deputies is that Alpha is not in the business of practicing medicine or providing actual and real-time medical advice. We are interested in providing a wealth of resources so that you can get professional care from appropriately qualified individuals. I think that's an important distinction. So we very much are looking to identify the concerns of the brothers and referring you appropriately. Do you have any comments, members of the panel? Okay. Well, I think I'd be remiss, given the pandemic that's upon us, without asking. I'm going to toss this out to the panel. Where do you view COVID-19 with regards to us safely returning to life as we once knew it? And I know it's unfair to ask you to give us a quick answer to that, but I'm going to toss this particularly to Dr. Narcisse, who deals with this perhaps more than anyone else other than myself. So do you want to provide a quick thought regarding Omicron, Delta, where we are and where we'll be headed?
Absolutely. I have a request of each one of you. Tomorrow is a milestone birthday for me, and I'm going to ask each one of you to get a present for me. And that present is get your COVID vaccination, including your booster. We're seeing in our communities a rapid rise in COVID. In the Houston area, we're seeing a doubling of the number of cases every 3 days. Our hospitalizations have risen by 24% in the last 1 week. We've enjoyed our holidays. There are more holidays to enjoy, but if you want to enjoy your holiday, if you want to have people have the ability to congregate with individuals and your family and your network, please get your COVID vaccination. It's critical.
Thank you. And with that being said, I want to thank our panel for this wonderful, lively conversation. And I will invite our General President to offer any comments that he's been sitting on based on how the conversation has gone. We greatly appreciate your leadership and what you've done to bring this initiative to fruition. So, Brother Dr. Lonzer, any closing remarks?
Certainly. I want to also offer a supplement to Brother Dr. Narcisse's comment that if it's recommended that you get your booster, get the booster as well. I think that it's very important to understand the significance of how, and I know Dr. Narcisse is our expert in geriatrics, that when we deal with the elderly and we deal with those who are also immunocompromised, either because of comorbidities or other components of that nature, it really can be challenging. So every opportunity you have to bolster your immune system, please do so. And I have training and professional demarcations in that area, and see it in the data when I look at that. And I know our comments were limited, so I would imagine that he tossed me that alley-oop to put in the hoop, and I thought I would do that. I also want to be a proponent of us disengaging misinformation. That's across the board when it comes to healthcare. And although there's some who will speak of evils, if you will, because of sometimes what the connotations may be around pharmaceuticals or therapeutics, but there should be a balance there. There should be the right cost, the right price, of course. But we also know that many of the diseases and things that we're dealing with, that we're facing as a community, as well as globally, they require sometimes some robust medications to try to help us to augment or make modifications to make life better. But I think when we can deal with misinformation from COVID-19 all the way through At one point, noni juice was even discussed about being something that was favorable for folks who had cancer or something. We want to dispel mistruths and put forth real truths and good guidance, much as the Surgeon General, Brother Sterling, had implicated earlier. And we're committed to making sure that we continue to have this dialogue move forward for us to have healthier lives as brothers, as men of the community, so that young people and other people in the community can see us and know that the men of Alpha Phi Alpha, much like our motto says, that we are indeed, first of all, servants of all, we shall transcend all. And that transcendence is through leadership, is through compassion, is through our humanity and our ability to touch others where they are and be the servant leaders that I believe God has chosen us to be. So I'm excited to be a part of this dialogue to help encourage and put resources behind this initiative and others. And I thank you all, wishing you all a very pleasant holiday season. And as we embrace a new year, 2022, let's take it by storm, brothers.
Thank you, Dr. Lonzer and Brother General President. I want to also thank those of you that have offered up questions. Brother Brooks, Brother Simmons, I believe, in the audience. It is these questions that will guide the Surgeon General Initiative moving forth. The vision for this is quite expansive. We aspire to be not just talking at you, but talking with you, taking direction from you, and being very responsive to you. We want to be data-driven. We want our programming to be effective, well-received, and something that you see the value in. We're going to continue to do this. I cannot leave this without saying thank you to those of you that have constituted the nearly 100,000 views of the various Surgeon General Initiative webinars to this point. It has been incredibly well received. We will continue to push forward. We welcome your request for topics, your questions, and your support. This doesn't occur without the interest. We know that the need is there, but without your interest, we can't believe that self-empowerment is high on our priority list. So keep it going, and we will continue to be responsive. As Brother General President said, we are only going to provide you best practices in public health, science, and medicine. So keep that in mind. I do thank you. I wish you the very best holiday season and the safest travel if you choose to do it, or simply time for you and your family. We actually will be back with you on Thursday, January 6th. We get to take a couple of weeks off here for the holiday season. And again, thank you on behalf of the General President, Dr. Willis Lonzer III, the Deputy Surgeon Generals, and all the members of the Surgeon General Initiative. Thank you so much. Be well, be safe. Have a pleasant evening. Good night, everyone.